Did your doctor order an ANA test and you are confused about what it means? Or maybe you've already got your test back and now you're worried about that positive ANA test. Stay with me because I'm going to explain everything you need to know about ANA testing and what those results really mean for you. Hi, I'm Dr. Diana Garnita, a board-certified rheumatologist. Today, I am sharing what 20 years of experience has taught me about ANA testing. This test is one of the most common reasons patients get referred to my office, and there is a lot of misunderstanding about what it really means. Before we dive in, there is something that might surprise you. A positive ANA test doesn't always mean that you have an autoimmune disease. Now let's start with the basics. ANA stands for Antinuclear Antibodies. The ANA test, or Antinuclear Antibody Test, is a blood test that detects antibodies targeting the nucleus of certain cells in your body. These antibodies are proteins that your immune system will produce typically in response to foreign invaders, like viruses, bacteria, or even medication. Sometimes your immune system might overreact, and that will result in directing the fight against your body cells, and these antibodies are formed. Here is what is happening during the test. Your blood sample is mixed with special types of cells. If you have these antibodies, they will bind to these cells, and then a fluorescent dye will make them visible under the microscope. But here is where it gets more interesting. Your ANA test will show two important things: a titer, or the level, and the pattern. A titer represents the level to which your blood sample can be diluted and still shows a positive ANA result. Now, simply put, the higher the titer, the more autoantibodies are present in your blood. Now, let's decode what these numbers mean. 1 to 40. This is really common in healthy people, and it can be seen in up to 31%. 1 to 80. This is still pretty common, and it can be seen in about 13% of normal people. 1 to 160. Here is where it's getting more significant because these numbers can be seen in about 5% of healthy people. 1 to 320 and even higher, this is more likely to indicate that you might have an autoimmune condition, but it can be seen also in 3% of healthy people. But this is crucial because these numbers are just one piece of the puzzle. In addition to the titer, all laboratories are supposed to report the ANA pattern. The pattern refers to the distribution of the staining produced when these antibodies react with the antigens in the test cells. The most common ANA patterns are homogeneous, when the entire nucleus is diffusely stained; speckled, when there is fine or coarse speckles throughout the nucleus; and then centromere and nucleolar, where staining is more concentrated towards the nucleus. But is the pattern suggestive of a specific autoimmune disease diagnosis? And the answer is no. While these patterns can provide clues, they are not definitive for diagnosing specific autoimmune diseases. The staining pattern is loosely associated with some autoimmune diseases, but certain situations are seen more frequent than others. It will direct us as rheumatologists to think about certain diseases, and I'm going to give you some examples. A homogeneous pattern is often associated with lupus or mixed connective tissue disease. A speckled pattern may be seen more frequent in patients with Sjogren or systemic sclerosis. A centromere pattern is most often associated with limited forms of scleroderma that we call CREST syndrome or primary biliary cirrhosis. and the nucleolar pattern may be seen more in patients with scleroderma or polymyositis. Let's talk about what can actually cause a positive ANA. There are 5 main reasons you might have a positive ANA test. Number 1, autoimmune diseases, like lupus. Nearly 99% of patients have a positive ANA, but also Sjogren's syndrome or Sjogren's disease, scleroderma, and even rheumatoid arthritis or psoriasis or autoimmune thyroiditis and autoimmune hepatitis. But here is something crucial to understand. Having a positive ANA alone doesn't mean that you have any of these conditions. A second common situation are infections, like infections with certain viruses such as EBV, CMV, COVID, TB, syphilis, or Lyme disease can cause a positive ANA. The third situation are medications, like some blood pressure medications, certain antibiotics, TNF-alpha inhibitors, or other biologics, or immunotherapy. This is a therapy that treats cancers. And the fourth situation is related to cancers, like lymphomas, multiple myeloma, breast cancer, lung cancer, or ovarian cancer. And we're going to talk about this a little bit later. And the fifth situation, yes, positive ANAs, as I said, can be seen in perfectly healthy people. But how do you know when to worry about a positive result? Here is my rheumatologist guide to when you should be concerned. If you have unexplained joint pain, unusual rashes, if you have severe fatigue, hair loss, severe sensitivity to sun exposure, Raynaud's phenomenon, when your fingers are changing colors, especially in the cold, when you have enlarged lymph nodes, dry eyes, or dry mouth, you should see a rheumatologist, because having some of these symptoms combined with a positive ANA needs further evaluation. Now, a common situation: can COVID-19 cause a positive ANA test? In my clinical practice over the past 4 years, I've observed a fascinating pattern. Many COVID-19 patients developed various autoantibodies, with ANA being particularly common. But it doesn't stop there. We are seeing a range of autoantibodies, including anti-double-stranded DNA, anti-TPO, anti-cardiolipin antibodies, SSA, SSB, SCL70, and many others. What the research tells us? The numbers are striking. 30 to 60% of people with a COVID-19 history develop positive ANA tests. Severe COVID cases show a higher rate of ANA positivity than just mild cases. Now, a notable Canadian study found a peak of ANA levels at 3 months post-recovery, followed by a gradual decline. Accordingly to a doctor from Stanford University, an interesting pattern has emerged in COVID-19 immunity research. Natural infection appears to trigger a broader antibody response when compared to vaccination. Why? The answer probably lies in how our immune system encounters the virus. During a natural COVID-19 infection, our immune system is exposed to multiple viral proteins, which will lead to a more comprehensive antibody response. In contrast, vaccines typically target specific viral components, particularly the spike protein, resulting in a more focused but potentially less diverse immune response. However, the situation isn't entirely straightforward. I personally have seen antibody development in both scenarios, after natural infection and following vaccination, and sometimes when previously undetected antibodies become more obvious after vaccination, particularly when patients experience symptoms. But this raises an important question. Could these antibodies trigger autoimmune diseases. The relationship between COVID-19 and autoimmune diseases is very complex. While most patients don't develop autoimmune conditions, those with genetic predispositions may be at higher risk. In my clinical practice, I've diagnosed several cases where COVID-19 infection appeared to trigger the autoimmune disease condition, such as rheumatoid arthritis, psoriasis, psoriatic arthritis, and lupus. But it is crucial to note that we are still in the early stages of understanding these connections. More research is needed to fully understand the long-term implication of both COVID-19 infection and the antibody responses after they are triggered. And there are many scientists around the world that are studying these relationships to better predict and manage the potential autoimmune complications. But I'm going to talk about that in a future video. Did you know that a positive ANA can also be related to cancers? Recent studies have shown that ANAs are frequently found in cancer patients, with a prevalence between 15 to 65% depending on the type of cancer. In some cases, the presence of ANAs may be an early sign of developing a malignancy. In others, the cancer itself or its treatment in patients treated with radiation therapy or immunotherapy may trigger the production of ANA. Cancers, specifically lymphomas or other solid organ cancers, can occasionally trigger the production of ANA. This phenomenon may be due to the cancer cells that can sometimes stimulate the production of this type of antibodies. And as the cancers grow, they can interfere with the normal functioning of the immune system, which can lead to an abnormal autoimmune response. Radiation therapy is a treatment option for many cancers and can also lead to a positive ANA. The therapy uses high energy particles or waves to destroy or damage cancer cells, which can also trigger the immune system response. The body, in its attempt to heal and repair the damage caused by this radiation, may also produce autoantibodies, including ANA. But this production can vary from person to person and does not necessarily mean that an autoimmune disease is present in that patient. Newer treatments for cancer can also alter or are supposed to modulate the immune system. Those are called immunotherapy, and they can also cause autoimmune diseases. But we are still not understanding fully how they correlate with the presence of positive ANA or other autoantibodies. But here is what most doctors won't tell you. The ANA test is just a screening tool. Think of it like the metal detector at the airport. It beats for metal, but that doesn't mean that everyone with metal is carrying something dangerous. A positive test should lead to more specific blood tests, to a careful evaluation of your symptoms, to possibly other diagnostic tests, and it should lead to a consultation with a rheumatologist. A positive ANA test is not a diagnosis. It's maybe the beginning of an investigation. However, a positive test alone without clinical symptoms does not indicate that you have an autoimmune disease. Come and work with us at Rheumatologist on Call, as we have helped thousands of patients in the last 4 years. Now, there is so much more to discuss about positive ANA tests, so watch this next video that will tell you all you need to know about the lab test that will diagnose you with an autoimmune disease.